You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with peripheral neuropathy. She lectures throughout the country on this topic. Her name is Dr. Carter. Dr. Carter, welcome to the program.
Great, thanks. Good to be here again, Randy.
Now, we've had you on the show talking about other topics before, and great guest, by the way. A lot of things to say. Now, for those people that don't know about your center, tell us, because you do more than just neuropathy.
Sure, yeah. Specifically, we work with patients who are suffering with type 2 diabetes, as well as patients who have hypothyroidism. And then, of course, we work with the patients who are dealing with peripheral neuropathies.
Okay, let's start off the bat with who has it, what are the symptoms, how big of a problem is it?
Sure, well, let me just give you a wide range of the different types of patients that we're seeing who are suffering with peripheral neuropathy. First of all, it can be anywhere from, say, a 42-year-old mom who's being woken up multiple times throughout the night due to the sharp shooting pains. And that's going to lead her...
this is the extremities, right?
Yeah, sharp shooting pains, in her feet, up to her legs, hands, and the arms. And of course, it's keeping her up throughout the night, makes her irritable and on edge there throughout the day. It's affecting her family life.
So it's like a shooting pain?
Yeah, it can be.
Okay.
And then it can be affecting a patient, let's say a 52-year-old business executive, where they're realizing that their fingers are becoming numb. They're not able to do some of the tasks that they were able to, and it's starting to hold them down there at work. So that's becoming a concern. All the way up to, let's say, 78-year-old grandfather who's now having numbness. They're going from the feet up to the legs, hands into the arms, and isn't able to feel things and is expecting amputation to come there down the line.
Really?
So we're seeing a wide range of people being affected by this.
Tingling, burning,
Yeah, really, what we see...
I looked at your website. I mean, what I know about
this... Okay, good. Well, I'm glad you did some research. But let me just give you a little scenario. First of all, typically, patients will start off having tingling. It's starting in the distal extremities, so being in the fingers or the toes. And then that will travel into the hands and to the feet.
So it starts there?
Yes, that's where it usually starts. And then from there, the tingling will go to a burning sensation. So burning pain in those areas. And then the burning goes to a generalized sharp shooting pain. And then that eventually will lead to complete numbness. And then that will progress, from the hands or the toes, or hands and the feet, up into the arms, into the legs, and it progresses up there. That's why it's called peripheral neuropathy.
And you say this is treatable. I mean, you see reversals in these symptoms every week, every day in your practice. Is that right?
Absolutely. This is what we do for our patients, is to help them reverse that neuropathy, so that way these patients who are dealing with chronic pain or complete numbness can actually regain function of those areas again.
Now, asking around, talking to some other doctors, and some people think this is a bad sign, that there's not much you can do about it, there's not much known about it, they know it's a nerve situation.
Right.
So what is your response to that?
It was a common belief before that once the nerve started to degenerate, it couldn't be retrained to function again. However, now with groundbreaking technologies, we're actually able to retrain those nerves so that way they can fire appropriately, so that way the numbness, the tingling, the burning, that sharp chronic pain can be completely reversed.
Are there millions of people, tens of millions of people that have this?
This condition, they're now estimating it's affecting between 15 and 20 million people in the United States alone.
What's your take on it? What's causing it, by the way? Is that an easy answer?
No. There are so many causes that have been identified. Right now, the number one cause, so to speak, is actually called idiopathic. So it's from an unknown origin. They're not able to pinpoint exactly what it is. However, there are numerous other causes. It could be heavy metal toxicities or diabetes, commonly causes peripheral neuropathies, hypertension, chronic high blood pressure, alcoholism, vitamin deficiencies. There's numerous things that can actually create these nerves to not be functioning the way that they should anymore.
Okay.
So when these different conditions present themselves, what happens here is the nerve cells, they shrink up. They become smaller because they're not getting enough nutrition. They're not getting enough oxygen or the minerals that they need, so they become smaller. Okay. And then from there, that nerve signal can't go from one to the next. Okay. That's where you get the neuropathy from, because the nerve signal can no longer be transduced. So you can get that
nerve back communicating again?
Yes. Once you can get the nerve cell to have the nutrition that it needs, so it can get enough oxygen, get all of those minerals, the nerve cells then can essentially regenerate. So that way the space between the two becomes smaller, and that nerve, the signal can propagate.
Now we should mention, and there's science behind everything you're saying today.
Of course.
Okay.
Yeah.
And you have a medical doctor. You have a team approach. at your center?
At our office, it is an integrative approach. So we have medical, alternative, all allied health professionals working together synergistically to help our patients achieve their specific goals for health. So we've got a lot of different tools in our office to be able to individualize the treatment for whatever that
Now, I asked you before, right before we went on, I think they're putting on the microphones, and I said, do you think people are suffering that don't have to be?
Absolutely.
And you said, absolutely. And I said, do you see people, and I was trying to catch you off guard, because sometimes people will tell me the truth off camera, and on camera they're very conservative. But would you say that if caught early, that most of this is reversible?
I'm so glad you brought that up. Early detection is so important, in dealing with this condition. I mean, and we started talking about it before too, is that we see a lot of men who are dealing with these conditions, and they're just kind of put it off.
Okay,
I
I agree
say
with
they're
that.
almost in denial that it's going on, or they just,
So tingling in the hands, in the fingertips.
Right. That's a problem. That's
And
not.
toes.
It's not natural. It should
pretty
not be
bad.
happening.
Pretty bad, then.
Of course. And then it gets to a point where they're dealing with complete numbness. They're having injuries in these areas that are healing very slowly, or dealing with swelling.
I know a dentist that had to stop being a dentist because of this problem. Because of this.
Right. I had a bus driver who was completely losing sensation in his feet. He couldn't feel the pedals anymore. So he had lost his job because of this. So of course he came to us. One of his goals was to be able to get his job back, but they wouldn't let him until the doctor cleared him for, reverse neuropathy, which they told him would never happen.
Now,
However,
I know that you want to stay positive. You don't want to bash traditional medicine or anything else, because you have a medical doctor there. But what is typically, help me understand,
Sure.
the people with the tingling, the neuropathy, peripheral neuropathy, how is it normally treated? And first line therapy, second, et cetera. And then I want to hear how you guys are doing it.
Okay, well, first of all, conventional treatment for the peripheral neuropathy medications. There are either...
Oh, is that right? Medication usually first.
Yeah, I mean, they're put on chronic pain medications. Diabetics are being put on peripheral neuropathy medications, and they're told that once they're on that, there's nothing else that they can do about it. And eventually what happens is patients become on more and more medications. The dosage is increasing as the body's accommodating, and from there, they're getting a lot of side effects from these medications too, because the medications are masking their problem. They're not really addressing it. As soon as the patient, not that I would ever recommend a patient do this, but if they ever just stop taking it, the problem's right there again. So you know that it's not healing it.
But
It's
these
not fixing the
medications
problem, it's just
obviously
masking it.
come with their own side effects as well.
Right, unfortunately.
And, okay, so if medication doesn't work, but is that pretty much the treatment? I mean, physical therapy?
Right, occasionally, yes. They
Chiropractic,
can
things like
go
that. I mean, that's
through physical
traditional
therapy,
approach.
they can go through chiropractic, but the bottom line is if the cause of the main problem is not addressed, then you can chase the symptoms down all you want, but it's all about addressing the true cause of the problem. That's what needs to get removed first in order to achieve all those other results.
And what
I
is
was
that
telling you
cause?
about. Like I told you, it depends. It depends on exactly how that specific patient is, why they're experiencing
But it's
it.
a nerve issue.
What does it come down to?
An electrical issue? Like a signaling issue?
Yeah,
in a way?
the electric current essentially is not flowing through the nerve the way that it should be. I mean, if you think of the nervous system of your body like you do the electrical system of your house.
Okay.
If there's any area of the body where the circuit is out, then that flow, that room, no matter if it's brand new or old or wherever you got it from, no matter what, if that circuit is off, there's not going to be any electricity in that room. Right? Does that make sense?
Okay.
So if you look at any area of the body where that is being affected, in the feet, in the hands, you're not getting that electric current going to those areas. That's how they're affected. So we need to.
So you can get that current going again?
Right, that's
How?
what we do.
How? Well, I mean, give
Right.
me a little bit of
So, okay, well, first of all, let me rewind. It's all starting about understanding the patient, really exactly what's going on with them, understanding their story. How do they get to the place that they are today? So they come to the office, we get a full, thorough case history on them, of course, and then we need to understand what their goals are with their health.
Why is their story so important, by the way? Because I've interviewed you on the other topics.
Mm-hmm.
Tell me that. Tell me why is that important for aside from getting a rapport with the patient?
Sure. I mean, that's
Why
what
is
I'm
that
saying. I mean,
important?
personally, it's important for me to understand exactly who I'm treating,
Like
who
their
am I
beliefs
working with.
about.
Not necessarily. It's to understand their underlying problem, what they've been through, how they've tried handling this problem
Okay,
in the past.
okay.
Once I can understand that, and I can also understand the cause of the problem. So by listening to the patient, we can understand what they've been through, what type of diets they've been on, what type of surgeries, traumas, other other things that could have played a part
Okay.
in the development of the peripheral neuropathy. So we understand the patient's case, first of all, and then we'll do individualized testing to understand where that cause is coming from, identify any inflammatory markers so that way we can decrease inflammation throughout the body as we go through with
This
treatment.
is a comprehensive program. By reading through the material, you're looking at food allergies, you're looking at nutrition, you're looking at hormone levels.
Right.
Is that right?
Yeah, it depends on that
You're
specific
healing
patient.
their adrenals.
Right. When
gut
you're
issues.
dealing with,
That's all connected.
of course.
Okay.
We address the patient as a whole, essentially. We can't just treat a patient as a list of symptoms. I'm going to tell you right now that doesn't work. A lot of patients have been through that in the past and they haven't gotten results, and that ends up in a discouraged patient. So we treat the patient as an individual, as the person that they are, to truly understand what's going on with them, and that's what's addressed. That's how, in the end, they reverse this
So
condition.
in Philadelphia, you're one of the people also that lectures on this, patient lectures. So, and you've been doing them for quite some time. What do they want to know about this? When the patients come in that have neuropathy, what are the frequently asked questions? They have to be skeptical, right?
Of course they are. A lot of them have been dealing with this condition for years. Some of them, over 20, 30 years.
Really? Okay.
And then, of course, one thing they want to know, well, does it really work?
Yeah.
Or how can I do that? They want to make sure that it is something they can truly achieve. And the first thing I tell them that if they're motivated, they're committed, they're ready to do this, then, I'm right there with them to help them
What's
achieve
your
those
best story?
types of
What's your
results.
best story since you've been doing
Oh,
this technology?
goodness, I've got so many. I'll tell you one
Like
patient.
one that surprised you, maybe.
One patient, actually, he told me that he had peripheral neuropathy, first of all, for 20 years. He was type 2 diabetic. In the past 10 years, it was so bad. He said, every time I go to my doctor, they poke my feet, say, can you feel this? Can you feel this? And every time it's no. And then,
Wow, it's that bad, huh?
yeah, he said they're poking him with needles, and every time they asked the question, can you feel this? And it was always no. He was never expecting, I don't think the doctor was ever expecting a different answer from him either. However, then, a few weeks into treatment after I was working with him.
Okay.
After I was working with him, then he said that he was sitting on the couch and, his grandson came over, started tickling his feet, and he could feel it. So he was excited about that. He could feel that. He could feel the tickle, and he was surprised. His grandson was surprised too. He said, Grandpa, I've been tickling your feet for years and you could never ever feel it. So that was a joke that they had. And then he told me what really surprised me was when I got in my car to come over to the office and I could feel the gas pedal. My first thought was, you couldn't feel the gas pedal? Of course. But he said, I've just gotten used to it to a point where I could just monitor the pressure. And when I could actually feel my foot on the gas pedal, it was just astonishing to him.
It's hard to believe, right? Even listening to the story is...
Right. It was incredible. And the fact he said, I never thought that I would enjoy feeling pebbles on the ground in the parking lot or, going to the beach and feeling the sand. He said, but I just want to do all of those things. That's a typical story that we hear in
So
our
does
office.
this neuropathy, this peripheral neuropathy, does it always get worse, or does it kind of just, people that have tingly fingers and toes will have it forever? Does it always get worse, or it can stay put?
Typically, once it starts, it will progress because as the nerve cells starts to degenerate, it gets less and less and less nutrition.
But
so the
people that
symptoms
have
will
numbness,
continue.
completely numbness, are getting it back?
Right.
You're seeing that?
Absolutely. This is something
Okay.
that patients were expecting in the end to be dealing with amputations. And I've seen numerous patients who not only them, but their spouse, their family members were concerned about them actually losing their limbs because of the progressive, peripheral neuropathy. So having the patients not only no longer worrying about a future of going through amputations, but now having that full function, being able to feel. I have patients say, I can feel my grandchild's cheek now, where I couldn't feel that before.
So it's now, going into this, I was thinking from a pain aspect because I was reading on. So is pain a big part of this or not?
Of course, chronic pain is a huge part of it as well.
So they're in a lot of pain.
Yeah, well, it's really on a
Combination
spectrum.
numbness and pain?
Some are chronic numbness and pain. Some have got chronic pain. Some just have numbness. You've got that whole spectrum of symptoms that they can be experiencing. Those chronic pain patients, the ones who are dealing with pain day in, day out, and this is hugely affecting their life. Not only physically, but it starts to affect them emotionally too.
Okay.
Think of, I don't know if you've ever been, God forbid, any type of injury, but someone who's dealing with chronic pain when they can't function appropriately.
Not a happy, yeah, I know a pain. My mother has been a pain patient her whole life.
Right. It's hard getting out of bed in the morning or getting in and out of their cars or, going to the store and pushing a shopping cart, picking up their grandkids. All of these different things become now this weighing thing on their mind.
Okay.
And when you're dealing with pain day in, day out, it starts to affect, like I said, that emotional aspect. So I see multiple pain patients who are also on antidepressants because they're now dealing with depression. Because we know chronic pain also leads to depression because of some, biochemical occurrences that happen throughout the body.
Okay. I've interviewed you about your diabetes program. You say, Randy, we have people that are on insulin, it's reversed. People that have been taking it 20 years, it's reversed. The other topic we talk about is thyroid. People that are taking thyroid, feeling lousy, and you guys identify, the underlying cause. It may be something else. It's reversed. Is this getting the same, your neuropathy program, is it getting the same kind of results as these others? Is it as predictable as these others?
It is, and that's one of the most exciting things about our patients with peripheral neuropathy is we're treating them. We start seeing results immediately, within the first few treatments in the office.
Why wouldn't every doctor in the country that deals with pain get one of these machines? Is it because they also don't believe it?
I can't give you an honest answer.
What's your guess? I mean, if it works.
Right. I mean, my guess is that in the future, everyone will.
Okay.
I just think we're not at a place yet where you've got that basic understanding that this is a reversible condition. Bottom line is, once you start getting results, people will talk.
So it's multiple treatments.
Yes.
Tell me about that. Tell me about what a treatment looks like, feels like, things like that.
So initially what the treatment will look like, well, after we get all of the blood work done, we understand the underlying causes, any inflammatory markers, we understand the patient's diet and can start getting them on a specific, maybe nutritional regimen. Then treatments in the office, they can be, they could be a few times a week, depending on exactly what the patient has going on.
Are they 5-minute, half-hour treatments? How
well, again, it all depends. I mean, that is one thing that I want you to understand about what we do, Randy, is it's very highly individualized. I'm very hesitant to say that we've got a peripheral neuropathy program because, if I'm working with 100 different peripheral neuropathy patients, they'll all be treated differently depending on exactly what they have going on. So the treatments can range anywhere from 5 minutes, half an hour, 45 minutes, depending on what that patient's going to need.
Are people surprised, by the way, when
they are,
with
and
the
I love
results?
that. I love seeing that. I mean, I'll have patients bring in their family members, who are excited about seeing these changes because not only is it, the chronic pain is disappearing or they're starting to get sensation back into their hands and their feet, but also there's visual changes too, where you can see the color coming back into the hands and feet, and the trophic changes that these patients have experienced. Initially the symptoms are dry skin or fragile skin or the cracking. You'll now see moisture back into the skin, and any diabetic ulcers, on the non-plantar surfaces or other cuts, they heal faster. The swelling goes down. So overall, when you can see the visual changes, of course, that's
so. This electrical machine, this machine that you use, are you convinced though you couldn't do it without looking at the nutrition, the right kind of supplements,
right?
Anti-inflammatory diet? Healing the gut, as you say, the intestinal tract.
Right.
Is that right?
Exactly.
So it all kind of goes together.
All tools that are required, and it's different for every patient as to exactly what is required. But it's not just one thing. I mean, it may be dietary changes, targeted nutrition, supplementation, or rehab or exercise.
Could somebody argue though that so they go through your 5 treatments, 20 treatments, or whatever, that is it just a temporary fix, or does the neuropathy come back? Or or does that nerve, do you get this stronger pathway where the nerve's communicating and it stops the...
Right. That's a great question. I mean, I wish it was the point where you can say, yes, once the nerve is regenerated, boom, you're done from there. However, that's not always the case. If the underlying cause is still present, whether it's something that the patient has, spinal stenosis or degenerative disc disease or some other sort of compression that can't be completely reversed, then yeah, they may need some home treatment from there on out. But let me tell you, these patients, if they've got to do some home treatment for 10 minutes a few times a week in order to keep the function of those areas, that's something that they're more than happy to do.
Now, when you say things like this and you say people are getting their lives back, okay, so you get rid of their pain and the tingling, the burning or whatever, the numbness, they become more active. So their life changes.
Of course, because they're not able to do all the things that they were able to do when they weren't in pain. I mean, you imagine these people who are dealing with this type of pain or numbness, and they're not able to be active, even if they want to be. Go skiing or go hunting or swimming or running or, whatever it may be. They're not able to do those things anymore. So when you relieve that from them, they can now enjoy their life again. So that's what I mean when I say they're getting back to the way that they were. They're getting
So you have an interesting model. Okay, so if somebody's watching this, they have a neuropathy, a loved one, they can call and they could go for a free consultation to find out if you're a fit. Is that
So
right?
they get
Do I
more
have that
information
right?
about exactly what we are, so that way we can really make sure that they are a good fit.
So we're going to take a quick break. We come back, more about the process and more questions about this treatment. I'm still not clear on exactly what you're doing. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, more about peripheral neuropathy and some of the new treatment options that are available. We'll be right back. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, peripheral neuropathy and some of the new treatment options available. Okay, so for people just tuning in, the symptoms. Run down the symptoms, defining what it is.
Okay, symptoms, it can go anywhere from tingling, numbness, burning, chronic pain, sharp shooting pains, trophic changes
In the
of the
extremities.
skin. Yes,
Okay.
on the extremities and the limbs. So the hands, the arms, the feet, the legs. Also can be, swelling in those areas. Ice cold limbs or pale. Secondary effect can be muscle weakness as well. So these patients are having poor balance issues.
What about sciatica? So that would fall into this?
Sciatica, yeah, that is another cause of peripheral neuropathy. That's essentially called a compression syndrome. So sciatica could be one. Also, carpal tunnel is another can create peripheral neuropathy as well.
Okay, so this is a neurological problem.
Correct.
You're treating it instead of with drug therapy. You're treating it as, your standpoint is it's an electrical problem. And I don't want to put words in your mouth, but do I have it somewhat correctly?
You do. It is a neurological problem. The transmission of the nerve signal is not going the way that it should.
So you give it like a jump start, if you will?
Essentially.
Okay.
So this way we retrain those nerves. So this way that signal can propagate again.
All right.
Does that make sense?
Kind of. Okay. But all that matters is that it works.
That's the bottom line.
Would you say 1, 2, 5 patients a week that are getting results with this?
Absolutely. I can tell you with certainty, I've never had a patient come to me and not get results. That's about.
So
we
far,
are a results-based office.
So far, everybody that's come to you for peripheral neuropathy, we're not talking about cures, but every one of them have said, I am so much better.
Right. We're seeing, the pain going down. Sometimes you cannot completely reverse it. I'll be honest with you. Sometimes if there's too much damage, they're far gone. I could be able to bring their pain levels down from, an 8 on a 1 to 10 scale down to a 4 on a 1 to 10 scale. You talk to one of those patients, that is huge. That is life-changing. They can now, they're at a level where they can function again, be able to do things that they were able to, so they can get in and out of their car. They can push a grocery cart. They can open up jars again. They could be intimate with their wife. They can be able to have that daily
sleep
interaction.
through the night. So sleep is a big deal.
It is.
For these pain patients.
Absolutely. We see that in the nighttime is the majority, or the night is when the majority of the pains are being.
So we're out of time. But somebody watching this that is just tuning in, so they have the symptoms, this peripheral neuropathy. You're saying that instead of taking medications, you have this like electrical stimulation. I'm calling it that, but that's kind of what it is. You treat the nerves, and you deal with their nutrition, food sensitivities. The whole body.
Right, exactly. It's addressing the underlying cause of the problem and then getting that electroneural stimulation in order for that patient to, for those symptoms to reverse, for them to get their life back, where they can, be active, have hobbies again, and, be the person that they were before this was.
So is this a very happy group of patients?
But
of all your
absolutely.
patients? Because I know you deal with diabetics and you deal with thyroid conditions, but is this, tell me how the responses are different with this.
Well, we do see response almost immediately with our patients who have this condition. Within the first few treatments, we expect results almost immediately. So, sometimes, of course, it may take longer depending on how long the conditions have been there, the severity of it and whatnot. But, some patients we see it on day 1. Some patients it may take, 6 to 8 weeks or so forth. But, you talk to those patients, that is not a long time, if they've been dealing and suffering with this condition for years.
So after the first treatment, though, sometimes?
Absolutely.
They feel good?
It's so exciting. They're surprised because they don't always expect to see, their symptoms reversing that quickly. But it's exciting. So when you ask if they're the happiest group of patients, I would say because getting any patient out of chronic pain is huge. It's life-changing for them.
And can you be too far gone to get some benefit?
No, absolutely. Like I told you, every single one of my patients who has worked with me has had the dedication that I have with them has gotten results.
Okay, good. Okay, so they can find out more how?
They could go to the website, call the office, and that way we can sit down and have a free consultation so we can really make sure that they are a good fit for the office.
Are people traveling, by the way? I've been told they travel to your center.
Yeah, I mean, on average, patient travels about an hour and a half to get to our
Really?
office. Mm-hmm.
Is that right? And they don't mind. It's worth it.
And that's the bottom line.
Okay, that's the bottom line. Okay, I want to thank you so much for coming on the show. Very interesting, good information, and we'll have your website displayed. They can go there, find out more. Can they request to speak to you?
Absolutely.
So you'll do like the consult if they want. Okay, good.
They'll see me.
Good for you. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to know or watch this interview again and maybe show it to a loved one or a family friend or whatever, you can visit our website at wellnesshour.com. We'll have it there. Just go under pain management, go under neuropathy, or just go under Dr. Carter. You'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.